Hey, so I said I was going to make a movie every 2 days or so, a long time ago in my last video, which is probably about 2 weeks now. I did make another video, and I even uploaded it, but I deleted it because it was terrible. It's absolutely horrible. I don't know, I was tired or something or what. But I'd gone to a wedding a couple weekends ago, but whatever. Anyways, I'll probably make a video every week or so. Every time I can think of something to say, think of something good to talk about, and have the focus to do it. I guess I wasn't too energetic at the time. But what I was talking about, and what I'm going to try to improve upon this time, is I was talking about the posterior pelvic tilt. I want to talk about sitting a lot again at the computer. It's pretty much a continuation of the sitting video at the computer and the walking one, the walking in posture. That's what I'm focusing on a lot. I've been helping my friend out with fixing his posture, fixing his hip and his shoulder mobility, and that's just what I've been thinking about, and also myself. So the thing that I've noticed that my friend and I both kind of share is him so more than me, but training him has kind of revealed it, has helped me notice it in myself as well. But the posterior pelvic tilt, and the pelvis is your hip, right? That crotch bone that you see in skeletons. And what the posterior tilt means is it's tilted this way towards you instead of being neutral. This is an anterior pelvic tilt where people stick their butts out like Donald Duck, and the posterior pelvic tilt is like this. And it's harder to see the posterior pelvic tilt. You don't see very well, but it's usually see it, say like when you cross your arms and distend your stomach and extend your hips forward. That's most often when it happens, when people cross their arms. And what it does is it pushes your lower lumbar spine forward, your pelvis forward, and your pelvis tilting backwards. And how it affects your kinetic chain, the rest of your posture, is your upper back will curve forward. We'll have more of a flexion. Your thoracic flexion, thoracic lordosis. No, kyphosis. No, lordosis. Your thoracic will be flexed too far, and that's partly what's been causing my my upper back pain, because it has to correct for this, it has to make up for this this tilt in my pelvis, and it's odd how the curvature works, but that's basically how it affects me. How it affects my friend is it's actually making his femur, his femoral head, his leg bone head, as it attaches into the pelvis, it's making the head push up against, or it's decentrating the joint. It's making the joint push forward into the socket rather than be centrated and kind of in a neutral position. And what that's doing is it's pushing his hip forward, like when he squats. If you see people when they squat low and they do that butt wink, you can see that their butt's tilting up and in, or down and in. If they squat too low and they don't have the stabilization down at their hip, that's what happens to him, and it pushes his hip forward and also pulls on his groin. His labrum. His labrum's a ligament, and a groin ligament on your femur and your pelvis, threatening to tear. So right now he's currently threatened to tear his groin because of this problem. And what I noticed the cause is slouching when sitting. It's not just all sitting, but it's slouching when you sit kind of on your upper butt and your tailbone rather than straight down on your butt. So it kind of depends on what you're sitting on, what kind of chair you're sitting on, and it probably mostly happens when you're playing games, something when you're relaxed, and you're just being lazy, lounging around. And it also causes tight hamstrings. That's why I have tight hamstrings, I think, or partly why I have tight hamstrings. Also, I have tight hamstrings just because I never stretched them when I was younger or growing up, hardly ever. But that's pretty much the main, or those are the detrimental effects that I know of so far. It impedes your squat, but lunging is pretty good. Lunging, just a lunge. So how to fix it? If you can notice that you do it, you should be able to. The optimal position of your hip is, sorry. It's right at whatever. You can see my underwear. It's right about here. You should be able to extend it, thrust it out. That's the posterior pelvic hilt. You should be able to pull it back. So the optimal position is right in between them. Centrate it so to have enough room to extend it and contract it. Flex it and contract it. Flex it and extend it. And how you fix it, there's several ways that I've noticed that I've kind of taken into account. Lunging kind of fix it. I think it's partly caused by a weak glutes. There's two things: weak gluteus maximus and medius, perhaps as well, or just weak glutes in general. And but squatting won't. If you have this problem, squatting will make it worse. It may not make it worse, but it'll cause problems in other areas because your body is going to have to compensate in other places for the instability in your hips, and it's going to tighten other areas, and it's probably going to spread dysfunction throughout your body. So, but a good exercise is lunges. Is fairly good, but before lunges, there's a therapeutic method where you kind of lay on your back and you hold your knee up, or you have someone hold your knee up and centrate and hold your pelvis in a good position, and push your knee up into the air, and you push on it. It's basically like a lunge without the ground force, with the ground resistance. It's basically a lunge but while making sure your hip is centered. So once you get that, then you can go into the lunge pattern, which will help centrate the femoral head into your socket. I don't know. Maybe I'll do some videos on stuff like this. You can probably find it online. Ways to centrate hips and fix pelvis, posterior pelvic rotations. But another way is watching Donald Duck. He has a massive anterior rotated pelvis, which means it goes forward like that. You all know. So one thing to do is you can do while you're sitting, or while you're walking, maybe, or whenever while you're walking too, is the muscle where you think would be on his tail, on Donald Duck's tail. Imagine the muscle that would be right in that spot. You can tighten that muscle that's the muscle that you would need to strengthen and tighten to make sure you can keep yourself centrated, but not too much that you go into an anterior pelvic tilt. But that muscle is probably the prime, one of the first things that you can strengthen to help you out. It's probably your absolute lowest back muscle. I don't know if it's the multifidus, part of the multifidus, which is the muscle that goes up and down your spine. I don't know exactly what muscle it is, but I can feel it. I can feel its effect. It might be like the lowest part of the multifidus. It's kind of that back indentation. You see very fit people, or chicks especially, with that back indentate, with those back dimples, lower back dimples. That's pretty much it. That's the muscle that you would use to keep a centrated hip, or at least anti-posterior centrated hip. And the other one was walking with full strides. So when you walk, I've been, I don't know if I said before, but I've been walking around a lot while I've been healing kind of all my injuries. And when you walk, or when I've observed people, I can notice people walking with their hips, like swinging their pelvis and sometimes their entire upper body. More so in women than men. I see women swinging their hips a lot more than men do. But you want to keep your hip straight, and extend your leg out forward and backward in its full range, or pretty full range. Don't take short steps. It's going to make you walk faster, which is a good thing. It's kind of it's a less lazy. It'll take more focus. It's a less lazy way to walk, I guess, which is why most people don't do it. But what it will do, it'll force you to keep your pelvis straight rather than like walking. Because I even noticed, I noticed that I definitely have a posterior tilt some of the times. Depends on what I'm doing. But I've noticed that when I walk sometimes, when I'm trying to keep straight or something, I don't know, I have a posterior, my hips stick out, and then that's kind of what causes my upper back to hurt a bit. So you're going to have to think, it's going to be something that you'll have to think about, especially if you're used to, or if you don't even know, if you're not even aware of how you walk and how you've been sitting. So check, see if it's a problem for you perhaps, and just note it, or make sure, or prevent it. Don't slouch. That's the biggest thing. I think the biggest primary cause of the problem is slouching. I've always slouched ever since I was young. And anything else? See, I'll come out of it with the next video sooner when I think of something to talk about. But that's what I've been thinking about recently. Probably later I might do shoulder dysfunction, because my friend, I know, I've been studying for him. I've been studying, and he's using him as my guinea pig to help him fix his shoulder and hips. He has massive shoulder problems too. It's more evident in his hips, but probably go over shoulder next. I'm sure there's some people who have difficulty with that. So thanks for watching. I'll talk to you guys later.